When you're young and healthy, the last thing you expect from a doctor's visit is a recommendation for open heart surgery. But that's what happened to one 26-year-old lacrosse woman last fall. As part of Heart Health Month, News 8's Madeline O'Neill shares her story.
Lisa, recently engaged teacher Michelle Schaub scheduled an appointment for foot pain in November. Little did she know she'd be scheduling a potentially life-saving surgery the very next month in December. Teacher Michelle Schaub has a big heart, especially for her students.
What's this?
But working with preschoolers and kindergartners at Providence Academy in La Crosse is a high-energy job.
Where are the plates? I remember coming to school and by 11 o'clock when they leave, I'm dead tired.
Turns out the same heart she loves her kiddos with could have killed her.
It was mind-boggling.
Without her ever knowing there was a problem.
I didn't think much of it. It's like I'm only 26. What could be wrong?
In November, Schaub went to the doctor for a swollen foot, but more concerning was her extremely high blood pressure.
I was really worried.
Family and coworkers convinced her to reschedule a follow-up appointment as soon as possible.
My heart went to Michelle, and I did. I said, "Can I come and be with you? Is anyone with you?" Because she had expected nothing of that type of news.
The appointment's news came as a surprise to Schaub,
I was in total shock.
as well as to the doctors.
I think that this is one of those cases that I'm going to remember for the rest of my life.
Dr. Millie Jha at Mayo Clinic Health System in La Crosse says she barely had to use a stethoscope to detect something wrong with Schaub's heart.
You can just basically stand by her and you can hear the murmur, so that was very surprising to me. I don't think in my life I've ever heard any murmur this loud.
A rushed echocardiogram detected congenital aortic coarctation,
Pretty unusual.
meaning Schaub's aorta was pinched, limiting blood flow.
This is the first time we've seen it as an adult.
Cardiologist Michael Myers says the normal aorta for a 26-year-old woman is about the size of a quarter. Schaub's could be compared to a pencil's eraser head.
About the size of a quarter, about the size of an eraser head.
That looks good. From where we started on there, it's very good.
Schaub is now on the road to recovery after open heart surgery, which fixed the defect she was born with in Mayo and Rochester in December.
This could have ended differently.
Had Schaub not been diagnosed and treated, exercise or a pregnancy could have killed her.
Just having that thought in the back of my mind, it's like, thank goodness I did it now.
In December, thoughts of open heart surgery filled Schaub's mind.
But here's the after.
Now back to work in February. Student-made heart valentines complete her reality instead.
Still in shock that I have open heart surgery, but it's so much better.
Now, Schaub will likely be on blood pressure medication for the rest of her life, but otherwise will live a completely normal life, and she says she has so much more energy. Her birth defect likely explains why she was always so tired and had headaches throughout her life up to this point.
Wow.
Yeah.
Thanks. So now, this defect is not common, but why is it so unusual for a 26-year-old to be diagnosed with this?
Right. Well, this particular defect called aortic coarctations are usually diagnosed when people are children, which is why it was strange that hers was found so late. But in recent years, Schaub and doctors had attributed her high blood pressure to anxiety, and instead it took a closer look to reveal that defect.
Oh, all right. Well, thank goodness it was caught.
Absolutely.
Thanks, Madeline.
You're welcome.